The biggest concerns when a family comes to us is, most of the time I would say number one is safety and quality of care. Those are very important, right? And those are top on our list. Keeping your loved ones safe, making sure that their quality of care is the absolute best, making sure that they are in a loving, safe, happy environment. Those are all that. Cleanliness is very important. That's very important to a lot of the families as well, because they're touring all these places. It's hard to keep them clean, but it's absolutely important. And then of course there's concerns with cost, resources, doctors, and how we address that is we're able to show off our community because we are the absolute best. We are a safe, clean, joyful, full of activities and community environments. So that's the easy part, right? Looking at, okay, where can we find resources? How can we make this work for your budget? Trying to ease their minds there. But also letting them know that they are paying for quality, and they're getting it. And that's important, and that they do get that quality of care, that their loved one, they're safe, they're taken care of, and they are getting what they pay for. I think is really important. But of course, that's always a concern. Another concern would be, communication. It's a transition for everyone, not just the loved one that's moving in, but really for the family. And having that care plan with the family, letting them know that there's open communication, that we're completely involved, that we're gonna bring in as many layers of services that we can, that they want, and a lot of that is for the family, is not for the resident, because they're living with dementia, so a lot of them don't remember, or a lot of our communication guidance is for the family, which as it should be, right? I mean, we want to make sure that they're looped in on everything, and they are. So that's always a concern. That's pretty much squashed out immediately because they see how good we are at communicating.